My name is Kim Teresi and I'm the Senior Advisor for Aged Care at Speech Pathology Australia. On behalf of Speech Pathology Australia, I'm very pleased to welcome you all today to this event to raise awareness of PPA and the vital and impactful role of speech pathologists. Speech Pathology Australia is the national peak body representing speech pathology and over 16,000 speech pathologists across Australia. We're very excited to hear today from a highly esteemed panel of presenters to learn more about PPA and the role of speech pathology. We have over 350 registrants here online today, and I know many more people are joining in watching from various sites across Australia, and we're really excited for you all to be here. So without further ado, I'd like to hand over to your MC of the event today, Dr. Cathleen Taylor-Rubin, and we'll hear more from Kathy about today's event. Thanks, Kathy.
Thanks, Kim. Yes, and welcome everyone. Very excited that this is our very first PPA Awareness Day in Australia. So I'd like to at first acknowledge and thank our colleagues in the United Kingdom, particularly Dr. Anna Volkmar and Rosemary Townsend, and the members of the UK Rare Dementia Support Service who started this initiative about 6 months ago. As Kim said, our aim today is to raise the awareness of PPA in the community. And yes, that the registration shows that we're off to a really great start with that many people registering. And encourage you to, if you find this helpful, to share with your family or your friends. So what we're going to do today is first a reflection on the lived experience of PPA. Then there'll be a presentation by Professor Olivier Piguet and another by Professor Kirrie Ballard and by Associate Professor Jade Cartwright. I will then go through some of the practical issues, and as we said, there'll be a Q&A at the end. And throughout the entire presentation, we'll be sharing with you some of the thoughts from the PPA community. So if we go to the next slide, we'll begin by viewing this artwork by Elizabeth Sweeney, Liz, we like to call her. Liz created this artwork in 2018 for an exhibition that was held during the conference of the International Society of Frontotemporal Dementia that was held here in Sydney in 2018. Liz has kindly given us permission to share this with you today. This artwork and her reflection put the lived experience of PPA to the front of our minds and at the centre of this webinar. The title is, I Feel Like I'm Fading to Grey. Next slide. So Liz says, before extremely social, positive, spontaneous, empathetic, humorous and confident, I loved a challenge. For 25 years, I worked as an educational consultant, a career where exemplar communication skills were the key. Organisation, facilitation, presentation of conferences and workshops, including working international educational leaders, researching new educational trends, writing papers, submissions and reports were core to my job. Now I'm positive but less confident, planned and less spontaneous, empathetic but less humorous, still social, but it's difficult and tiring to sustain conversation. I'm more of a listener and then a contributor. The telephone is now my worst nightmare. Frustration is creeping in my life by having someone recheck my writing. Researching into PNFA is interesting, but I feel a little daunted by the future. Grateful for having the opportunity to create my own synthetic voice through Model Talker. Completely humbled by the love of my partner, family and friends. So I know Liz is watching. Liz and Tony, thank you so much for sharing this with everyone today. I'm sure there were people nodding their heads as they heard your words. So we'll just follow on that theme of hearing the lived experience with a few thoughts from some of the members of our PPA community. And thank you to Dr. Penny Monroe, who will present this section.
So we asked people living with PPA and their care partners, what does speech pathology give you? Speech pathology gives me supports and ways to remember the right words and thoughts. Gives you confidence in what you're saying. Diagnostic certainty. Clear information re what is happening and what to expect. Help with navigating supports and services, and an idea of timeframes with progress of the condition. It's a bit like doing regular exercise or being active with my language challenges. Speech pathology gives me professional and trusted advice on how to best tune my language skills to support how we live on a daily basis. It gave us hope after the initial diagnosis. We had twice weekly sessions for the first year, I think, then weekly for 8 to 10 weeks. It gave Brian a plan of attack, response for conversations.
Thanks, Penny, and thanks to all the contributors with their wonderful comments. Now I'm going to hand over to Professor Olivier Piguet. Professor Piguet is the Director of Frontier, the University of Sydney-based Frontotemporal Dementia Research Group, and an NHMRC Leadership Fellow and Professor of Clinical Neurology and Neuropsychology at the University of Sydney. He has over 20 years of experience, clinical and research, in the field of aging and neurodegeneration. And it's our great pleasure to have you talk to us today, Olivier.
Thank you so much for the invitation. It's great to be part of this first PPA Awareness Day. It's so important to be able to raise awareness about PPA. As you've said, Kathy, I've been working in this field for a number of years now. And yeah, thank you for the invitation to talk about PPA. And so I've been asked to give a brief and broad overview of what PPA is or what PPAs are, because there's more one type of PPA, and you know, there's a reflection. I can't remember who said that, but you know, when you've seen one person with PPA, well, you've seen one person with PPA. So there's a huge variability in how people present when they go through a journey of living with PPA. And so it's important to be able to recognize the different presentations and different challenges that people may experience. So I'll walk you through, and again, it'll be a quick overview of what PPA is. So broadly, PPA is generally divided into three categories, and I've labeled them on this slide. So there's the logopenic variant PPA, the non-fluent variant PPA, and the semantic variant PPA. I'll talk about the challenge also, or some confusion that may exist in the field, because there are different classifications that exist. But for the purpose of this presentation, we'll talk about logopenic variant, non-fluent variant, semantic variant. Now, I've separated that in two groups for a reason that will become a bit clearer in a few minutes. But logopenic variant PPA is an unusual presentation of Alzheimer's disease. So most people, when they think about Alzheimer's disease, will think about memory problems and difficulty navigating the environment and so on. But Alzheimer's disease can present in many different forms, including logopenic variant PPA, but also frontal AD and posterior cortical atrophy. And pathologically, and I'll come back to that in a minute as well, it is separate from the other two variants of PPA, non-fluent variant and semantic variant, which come under the umbrella of frontotemporal dementias. And in addition to these two PPA variants in frontotemporal dementia, what we have is also the behavioral variant frontotemporal dementia, and then often and also associated movement disorders like motor neuron disease and corticobasal syndrome and progressive supranuclear palsy. And it's not uncommon for people with a diagnosis of PPA to start developing other features than language that they may experience early in the disease process. Now, most of us now follow the classifications based on these two papers that were published in 2011. So there's this brain paper looking at more the behavioral variant, frontotemporal dementia, and then this paper written by Gorno Tempini and colleague looking at the classification of primary progressive aphasia. So again, it's slightly different, but we're essentially talking about the same thing. So in one classification, we're talking about semantic dementia, which is equivalent to semantic variant of PPA, and the progressive non-fluent aphasia, which pretty much approximate or is the same as non-fluent variant PPA. Now, all these in the red box are part, as I was saying, of the frontotemporal dementia landscape, whereas the semantic variant, non-fluent, and logopenic variant PPA are part of the landscape of PPA, and with logopenic being caused by a pathology linked to Alzheimer's disease. So in this classification paper led by Gorno Tempini, what they highlighted was really these inclusion criteria. It was that the primary feature of the difficulty had to be around language, and that language was the primary cause of impairment in daily functioning, and that it was present from the onset of the disease. They also highlighted a number of exclusion criteria, and over the years it has become slightly problematic because here they state that the language disturbance was to be the most prominent thing, and so you shouldn't see other deficits like episodic memory, visual memory, or visual perceptual impairments. And also that having behavioral changes early on was an exclusion criterion. However, it's become increasingly apparent that a primary progressive aphasia is more than a disturbance of language. And it's very common to see other features, including difficulties in other cognitive domains like language, like memory, like executive functions, like visual perceptual skills, but as well in terms of behavior. We often see changes in behavior, difficulty with aspects of social cognition. And I think it's important to recognize this when it comes to conveying to the person with dementia, but also the care partners and family members, that some of these things can also occur in the presence of a diagnosis of primary progressive aphasia. In this paper, they outline for each subtype of primary progressive aphasia a number of clinical features, which I'll go through again fairly briefly, but to highlight the commonalities and differences across these different subtypes. So the first one I want to focus on is the semantic variant aphasia, primary progressive aphasia. It's an interesting and intriguing presentation because in terms of language, it's classified as a fluent language disturbance. So if you hear someone speaking with a diagnosis of semantic dementia or semantic variant PPA, you don't necessarily, if you don't pay attention, you don't necessarily identify some errors, but however you start listening, you can hear that the speech is quite empty. So people use words, but without necessarily the right meaning. And really, this syndrome of semantic variant PPA is characterized by a loss of memory for semantic knowledge, so a loss of memory for words. And so there's a difficulty understanding the meaning of words and what things mean. So difficulty recognizing what objects are and how to use them. But ability to speak or to use these words in speech and conversations that is preserved. And the way we can test that is by presenting pictures and asking the person, well, like for the example that I'm showing here, the hippopotamus, is to say, well, what do you call this? And what you see in individuals diagnosed with semantic variant PPA is that there's this marked difference between the naming aspect, which is impaired. So often they will tell you, I'm not sure. But if you say, can you say the word hippopotamus, they will be able to do that very well. And in the same way, if you present an array of different animals that are semi-related to your target items, the hippopotamus, and you say, can you point to the hippopotamus? And the person will have really great difficulty in doing that. And often you see that with disease progression, that it starts to encourage in increasingly common categories. So at the beginning, it's more for unusual words, but as the disease progresses, it will affect like more broader categories, like difficulty recognizing more common animals like dogs or cats. Now, when we look at what is happening in the brain, what we see in most individuals diagnosed with semantic variant PPA is this marked atrophy that is highlighted in yellow here in the temporal lobe of the brain, and particularly on the left-hand side, which is where the semantic knowledge is stored within the brain. Now, if we focus now on the non-fluent variant PPA, it's a bit of the reverse, the other side of the coin, where it's an expressive dysphasia or aphasia in that the speech here is very much hesitant, distorted, and slurred. So comprehension is preserved, but the expressive speech is very much affected with sound errors, word errors, and therefore individuals tend to speak less because it's more difficult, and often it's characterized by also a loss of grammar. So sentences will be, or verb use will be incorrect, or they will be incorrect use of prepositions or plurals when it's meant to be singular, and so on. And if we use the same test of naming and repetition, again, you see the other side of the coin, where the naming is reasonably preserved. So they will be able to tell you or to attempt to say the word of, they will recognize the hippopotamus, but they will have great difficulty in repeating these long words, these multisyllabic words. In the task of pointing to or selecting the right target item, he points to the hippopotamus. Again, this will be preserved. Now, if we look at the location of brain atrophy, it is very much in different location where it's more encroaching the motor aspects of the speech production, again on the left hemisphere and less so on the right. Finally, for the logopenic variant aphasia, it's again a non-fluent a PPA where there's also some difficulties in speech output, but it's more at the single word retrieval. So, and the errors that you will see are more at a phonological level rather than distorted speech. And one aspect that is striking is this impaired sentence repetition. So, which is caused by a disturbance in working memory. So the capacity to manipulate word online is very much reduced. So if you use a test like the sentence repetition, the person might be able to repeat three-word sentences, but as soon as you get beyond 4, 5, 6 words, then they start having difficulty because of this difficulty manipulating all these words together. But again, here the comprehension is spared and also the grammar remains reasonably intact. Again, if we look at the location of brain atrophy in individuals diagnosed with logopenic PPA, it's more posterior in the brain, so around the temporoparietal junctions, posterior temporal regions, again on the left. Now, one difficulty in this field, as with all dementia syndromes, is that you'll see these different features across syndromes. So on the left-hand side, you can see here these bar charts where the black indicates more severe difficulties for these different features that I've talked about. But the reality is that often there's a mix of things happening where some people will have difficulty with naming, a little bit of agrammatism, and also might have also some difficulties with single word comprehension. So trying to disentangle these different things can be quite challenging, particularly as the disease progresses and where you have a progressively overlap in different features and symptoms. And that's also where you start also seeing additional features emerging more prominently, like in social cognition, difficulties in other cognitive domains like memory, executive functions, and so on. Coming back to my first slide, one aspect that is really important, why we need to be able to diagnose PPA more accurately, is that, as I was saying, the pathologies are different. So in logopenic variant aphasia, we have pathology involved in Alzheimer's disease, whereas it's frontotemporal lobar degeneration pathology in the brain for the other two syndromes. I'm just mindful of the time, and I think I'm going to skip on these aspects of pathological classification, but just to highlight that the most consistent pathology is found in the semantic variant PPA, which is highlighted here in blue. So at the top, you have the syndromes, so the semantic variant PPA, the non-fluent variant PPA, and Alzheimer's disease here. And you can see that the colors are associated with the type of pathologies that you can find in the brain. So semantic variant is predominantly associated with one type of pathology, which is FTLD TDP type C. In contrast, non-fluent variant primary progressive aphasia is mostly associated with this family of pathologies, which is part of the tau family. And in some instances, Alzheimer's disease. And then for logopenic variant PPA, as I mentioned earlier, it's mostly associated with Alzheimer's disease in the brain. So essentially what you have is that when one pathology can cause multiple symptoms and vice versa. So it can be quite messy. Where I feel that speech and language therapy is really important, and it's been touched on by the quotes that we saw earlier on. Speech pathology has a critical role to play in aiding with diagnosis, particularly in the non-fluent variants. The distinguishing between non-fluent variant PPA and logopenic variant PPA is difficult, and that's where the expertise of speech pathology comes into play. It's also helping, as we saw in these quotes, in ascertaining what the impact of these language difficulties are in daily life and helping finding ways to compensate for these difficulties. And also, as I was saying, each person is unique and will require some individualized interventions, and speech pathology is really helpful in that regard. So just to summarize, I think we understand way more about PPA now than we did even 5 years ago. The early diagnosis is still challenging, and trying to understand, particularly predict the disease progression at the individual level is difficult, because there's again a huge variability across people. Obviously, there's still no disease-modifying treatments for PPA, but there's progress. There are some clinical trials trying to target specific pathologies that will eventually address some of these deficits in PPA. But yeah, for me, certainly the role and the use of speech therapy in PPA at multiple levels is really important and has real positive impact. And that's it from me. So thank you very much. And again, I'll be happy to take questions once we've finished or when we're towards the end.
Thanks so much, Olivier. That was a lot of information, but very clearly put. Thank you. Penny's going to give us a few more of these lovely quotes. Thanks, Penny.
So we asked, how does speech pathology help you? It helps me to lessen the problems I had with word substitution. It has helped improve my confidence. Speech pathology provides valuable ongoing support to us as the disease progresses. Every day is different, and having caring and professional support around language and swallowing difficulties and how to navigate them is critical to us living well with PPA. Being alongside my wife as she started speech pathology as a major step along her post-diagnosis journey has brought to life the concept and an understanding of a new dimension of our relationship with me as a partner and now also her carer. I can't say enough about how working with my speech pathologist, Penny, has allowed me to improve my abilities to communicate effectively. Speech pathology has given me more confidence and strategies to deal with the impact of my non-fluent progressive aphasia now and into the future. It provided Brian with a regime of how to tackle the difficulty of putting words together so he could still communicate with his friends and family in person and on the phone. Take a deep breath, go slow, use pauses to get your message across. It helps the people living with PPA cope better with their speech pathology. It helps the carers better understand the condition, and this leads to carers becoming more supportive. PPA speech groups help me express myself in a safe environment. We feel 100% supported by speech pathology on the path forward. We appreciate it so very much. As my husband lost the ability to understand words and to speak, speech pathology helped me continue to communicate with him, to understand and to navigate through what would have been a wilderness.
Thanks so much, Penny. Now we're going to hear from Professor Kirrie Ballard. Kirrie is a professor of speech motor control and disorders at the University of Sydney and the Frontotemporal Dementia Research Group. She's a certified practicing speech language pathologist in both Australia and the USA and a fellow of Speech Pathology Australia. She is a founding director of the PPA Communication Project, a student-led, family-centred speech pathology clinic based at the University of Sydney for families living with dementia. The clinic works with families across Australia to support them in their long-term communication needs in the community. So thanks very much, Kirrie. We're looking forward to hearing this.
Great. Thank you, Kathy. So I'll be presenting an evidence update on speech and language treatments that have been published and researched for primary progressive aphasia and apraxia of speech. Thanks. So speech language pathologists can help with a number of things, maintaining speech and language skills in the face of the ongoing condition, alternative ways to communicate. So looking at using, along with your speech, using gesture, writing, some digital apps on your phone, those sorts of things. We very much help people identify how those sorts of things can assist and setting them up. We also have a role to play if anyone starts to develop difficulties with eating and drinking, but we won't focus on that today. Today, we're focusing on speech and language skills. So the next slide, what evidence do we have? Well, to guide speech-language pathologists in the services that we can provide with confidence, research evidence is absolutely critical. And this can support us with treatment approaches and activities, how they work, and who they might be most suitable for. To bring together all of the available research evidence, an international group of us completed what's called a systematic review in 2023. So a systematic review involves finding all the research studies published across the globe, then reading them thoroughly and analysing their quality and the strength of the treatment effects and who they work for. So it was published in 2023, and I'll be providing a very brief summary of what we discovered. So what evidence do we have? When we looked at these studies, we found that there were 103 studies. So in the bigger scheme of things, that's not very many, and that was over quite a number of years. Of those studies, however, only 45 were high enough quality to really analyse thoroughly. In them, we discovered that about 304 people with primary progressive aphasia had participated, and nicely, about an equal number of males and females. That's not the case in aphasia conditions that we see after stroke, where predominantly the research has been with men. So it's nice to see this balance. We also found that there's a fairly even balance across the different types of primary progressive aphasia, predominantly non-fluent, but similar numbers in the semantic and the logopenic variants. Far, far fewer studies looking at people with apraxia of speech, which is a movement condition affecting speech production that you see in the non-fluent variant. Interestingly, although not too surprisingly, we found that the vast majority of the studies had been working on word finding. So that is working at the level of the word, coming up the words you want to use. And often this is typically involving naming objects, naming pictures or photographs. And this makes sense because word finding is challenging for almost all people with PPA, with primary progressive aphasia. We also found that some treatments have focused on grammar and fluency, and that's typically in the non-fluent variant. So building sentences and saying those sentences fluently, as well as some on writing, so using an alternative approach to speaking and spelling as part of that writing. And then, importantly, there are also studies focused on discourse. So this is using language for more functional daily activities like telling stories, having conversations, explaining tasks to those around you, like explaining to your son how to change the tire on the car. So it is where we use language to communicate and interact with our friends and family. And while there are very few of these studies, just 4%, the number is increasing because it is so important to work on discourse to help people with primary progressive aphasia stay connected in their community. So very encouraging to see an increase in more recent years in this discourse focus. So what have these studies found in terms of their impact, how effective they are for people with primary progressive aphasia? Well, all of the studies found the improvement, found that the treatment improved communication for at least some people in the study. So majority of people are benefiting. The majority showed that improvements were also seen in other related communication skills. The majority showed improvements that maintained after the treatment had ended. And in a small number of studies that measured the change in actual real daily communication, the results were positive. The treatment had made a real difference. So the important thing here is to understand that these interventions, by working on communication, learning new strategies, practice makes perfect, practicing learning ways to both improve but also compensate for the difficulties has an impact, and that impact can allow people to maintain more functional communication skills for longer, and therefore maintain a bit more independence for a bit longer. And not just days or weeks, but for at least a couple of years. So the message is, what does this mean as we move forward? Well, we know that more studies are coming out every year. There have been more studies published since we did that review. A high proportion of the studies are of high quality, and that is also improving every year. We also know that these studies tell us that there is strong support to refer people with primary progressive aphasia to a speech-language pathologist, and the earlier the better. The earlier that we can start working with families, the more impact that we can have. We know also that speech therapy can help with maintaining communication skills, finding new ways to communicate successfulully, which ultimately helps individuals stay better connected to their communities. Thank you.
So that's probably a good moment for us to move on to our colleagues in medicine. We asked them, sorry, Penny, I'm going to read the question. Why do you refer your patients to speech pathology? And we have some lovely answers here. I'll hand over to you, Penny.
I refer to my speech therapy colleagues because words matter. An accurate diagnosis allows more nuanced management, and early intervention results in better outcomes, be it functional communication or well-being, in such difficult circumstances. To access cutting-edge speech-based therapies for PPA. I refer my patients so they can benefit from the specialist expertise to optimize their communication needs. Patients exhibiting language-predominant dementias typically present at a later stage and often experience significant emotional distress due to the loss of language abilities. It is crucial for clinicians to engage speech pathologists early in the diagnostic process. This collaboration ensures that patients receive an accurate diagnosis and appropriate support from the outset of their care. Speech therapy can make a huge difference, both with diagnosis and management. Dementia often changes how my patients communicate with others and can lead to stress and challenge for them and those close to them. Speech pathology can powerfully identify the best ways to keep communication effective and forms an important part of a team-based approach to treating dementia. I refer to my amazing speech pathologist to confirm diagnosis, especially semantic variant of PPA, as I know I will get an expert opinion with brilliant care and follow-up. I rely on her wisdom and knowledge in PPA. To assist the diagnostic journey and to provide strategies, education, support, and future planning for communication. For specialized speech and swallowing expertise. Communication connects us to others, and that connection is fundamental for our sense of safety and well-being.
And thank you to our colleagues in medicine for those lovely affirming comments. Now it's my pleasure to introduce Associate Professor Jade Cartwright. Jade is a speech pathologist researcher and educator at the University of Tasmania, and she's also passionate about supporting people with PPA and their families. Thanks, Jade.
Thank you so much, Kathy. So I am a speech pathologist and researcher. I'm originally from Perth in Western Australia, now working in beautiful Lutruwita alongside the Carnamaluka River in Launceston at the University of Tasmania. So I have the privilege today of presenting on supporting communication and connection in PPA, which is a topic that I'm very passionate about. So Kirrie provided a fantastic overview of the current evidence base, noting the range of intervention options that can benefit people with PPA. So these interventions often target specific communication skills like word finding or spelling. So this is a really important part of speech pathology support for people with PPA. However, we also need to take a step back and to think about how we might use these therapies to support connection more broadly. I loved Dr. Ireland's quote that Penny read in the previous section. Communication connects us to others, and that connection is fundamental for our sense of safety and well-being. So this is so true. We need to provide the right support at the right time to help people with PPA stay connected to the people, the places, activities, and roles important to them. There are so many ways that we can do this when we work in partnership to find tailored and person-centered strategies that support connection and quality of life. So I'd like to dedicate my presentation today to the many people with PPA and their families who I've worked with over the years, who've taught me so much more about PPA than I could ever learn through a textbook, and who have helped me understand the sorts of services, programs, and supports that are needed and most valued. When we listen to the stories of people with PPA, we do realise the uniqueness of each person and each experience, as well as the diverse ways we can support communication and connection, noting that these strategies have to evolve over time. The more we listen and learn together, the better chance we have of getting the strategies and supports right and maximising the benefit and reach of our services. So in particular, I would like to acknowledge a wonderful group of people with PPA and their care partners: Robin, Narelle and Sean, Maz and Astrid, Tony and Jenny, Judy and Lisa, Alan and Christine, and Natalie and Daniela, who worked with Tracy Graney, myself, and a team of speech pathologists and speech pathology students to co-design the first PPA support group network in Tasmania. So this has been a wonderful collaborative project where learning from people with PPA and their care partners has been at the heart of program development. We came together over a weekend for intensive co-design work. This began by sharing stories about PPA, the impact of diagnosis and the challenges of navigating the system and finding health professionals who know PPA well. The stories also captured the benefits of speech pathology support when accessed, like the wonderful quotes that we've been seeing throughout today's webinar. So through this storytelling and intensive collaborative work, connections formed very quickly, and our co-designers with PPA and their care partners reported feeling less alone. For all of our group members, this was the first time they'd met others living with PPA, and while each story and experience was different, there was shared understanding, a sense of trust and solidarity. Through our conversations and brainstorming, we envisioned what an ideal support group would look like, what it would feel like, and what it would involve. 3 key themes or learnings were identified by the group, which informed the design of the support group, which we've since piloted together with really positive outcomes. The learnings also provide 3 guiding principles for supporting connection in PPA that we wanted to share widely today. So the 3 learnings or principles are not losing you in the diagnosis, the importance of supporting people with PPA and their care partners, and the need to create a community of care. These principles encompass the importance of holding people with PPA in connection with their own sense of self, with others, and with community more broadly, and we'll explore each of these in turn. The principles provide insight and guidance into the type of support that people with PPA and their care partners value, and how we can help people with PPA and their families to stay connected and to successfully navigate the evolving nature and impact of PPA in positive, proactive, and supportive ways. So the first principle is not losing you in the diagnosis. This is about connection to self and keeping or renegotiating a strong sense of identity or who you are as a person. We know that PPA is associated with changes in language and communication, impacting a person's ability to find words, to follow and contribute to conversation, and to participate in activities and roles that rely on communication. This impacts confidence, which can also impact a person's identity or their personhood. Yet it's important to know that PPA doesn't change who you are inside. The person remains. Yet we need to discover creative ways to optimise communication and to help people with PPA to express and connect with their sense of self. To support connection to self, we need to engage with the stories of people with PPA. We need to get to know people deeply. What matters to them as a person? What brings their life meaning? What activities and roles do they want to continue? When we have this deep knowing of the person, we can then tailor our communication strategies and speech pathology supports in more creative and effective ways, like the communication cards and aids shown on the screen, to support communication and provide a bridge to connection. These strategies are most effective when they align with a person's goals and their own motivations. For example, being able to order lunch independently, to share preferences with others, to continue work or volunteer roles, to recall the names of important people and places, to share important stories from your life, or to hand those stories down to children and grandchildren. By knowing you, we can help to find strategies that will support communication, that will keep relationships strong and help stay connected to your own sense of self and identity, which we know are so important. So I love this quote on the screen that stories tell who we are. And we really found this in our support group. We structured our group sessions around creating an About Me book, which provided opportunities for communication practice, as well as getting to know each other more deeply, seeing the unique, amazing lives that each person with PPA is living, celebrating achievements from the past and looking to the future while deepening relationships. Not losing you in the diagnosis is a powerful principle to be guided by. The second principle highlights the importance of supporting people with PPA and their care partners. Emma Hemming-Willis, Bruce Willis's wife, is doing wonderful work in this space, highlighting that PPA is a family disease or a family experience. It impacts the person with PPA and the people close to them, and we need to support everyone in that family and in that support network to reduce the impact of PPA. This is about holding people with PPA in connection with others, supporting relationships and social connectedness, which we know is such an important part of our shared human experience. We need to appreciate that care partners shoulder an immense amount of responsibility. We know how hard you work to navigate the system to find the right health professionals, the right programs, services and activities in the community to help communication and to support participation and engagement. We know this can be challenging and exhausting, and we need to provide tailored support for care partners, helping you to stay well and connected to the things important to you, while also supporting you in your care partner role to be the best care partner you can be. So here, speech pathologists can offer communication partner training, working with the person with PPA and their care partners to find strategies and tools to support conversations and connection. Again, these strategies are most effective when they are tailored to your unique needs, interests and circumstances as a couple and as a family. Often this is about finding bridges or stepping stones to conversation and connection, also important for friends and colleagues. It might be knowing the best topics of conversation, the best visual supports or pictures to use to help find words or to tell stories, or perhaps knowing when it's appropriate to shift focus from conversation to activities and spending time together, taking the pressure off the words but not losing connection. This principle is about connection to others and peer support, which we know from research and experience is so important for people with PPA and their care partners. And this is where support groups play a really critical role. Connecting with people who understand, who are experiencing similar things, allowing new friendships to form and to share strategies and provide emotional and practical support to each other. We've seen the value of this peer support through our co-design work in Tasmania, with one care partner stating, "You can learn from and lean on each other." So the third principle is the need to create a community of care that wraps around the person with PPA and their care partners. This principle acknowledges that care partners can't do it all. One of our co-designers identified, you need a bigger container to hold everybody. You need a community of care that shares the load and that creates safe and enriching opportunities for connection. Ensuring that PPA doesn't mean that life stops in any way, that it offers opportunities for growth and new connections, moments of joy and fun that community helps foster. In our co-design work, we really identified the need for more activities, programs and places in community where people with PPA feel safe, welcomed and included. Places that accept all forms and modes of communication and where difference is celebrated. We were successful in creating this through our support group model. We created the right conditions for people with PPA and their care partners to feel safe and welcomed, where there was no hierarchy, where the focus was on fun and social connection, where we had some structure created through the About Me books, but also flexibility to go off script whenever needed, to keep the focus on connection and on people and their stories, not their PPA. We've learned so much through this project, and the group we co-designed would have been very different if we had have done that alone as speech pathologists. It's showing the power of working together to create a community of care that connects people and gives strength. So to see these principles translated into practice, we do need to work together to continue raising awareness and advocating for better service access for people with PPA and their care partners. And this is why today's event and PPA Awareness Day is so important. It will take collective action, spreading the word that this is the support required and providing examples of what support can look like. If we can create a community of care for people with PPA and empower more supportive and inclusive interactions, activities and programs, then we can change the experience of PPA together. So this is a call to action, and I hope it inspires you to think more broadly about what is possible, about the value of speech pathology services for people with PPA and the importance of holding on to hope, creating the right conditions and knowing people deeply, engaging with their stories to support communication and connection. So thank you.
Thank you, Jade. Yes, I think that last comment you made about a call to action, that's why at the beginning I said it'd be really great if 2 or 3 people in the person with PPA's network also gets to watch this when you get the recording. So thank you for that. Let's just have a few more quotes. Penny, thank you so much. Penny's also a speech pathologist from Frontier. I apologise, I didn't introduce you properly.
That's quite okay.
You're doing a great job. Thanks for reading out these next few quotes.
Pleasure. So we asked people living with PPA and their care partners, what do you want people to know about speech pathology? The treatments received gave an opportunity for practice and refinement. It gave plenty of ways for discussions and debate on prepared topics. There is no tablet to take for PPA, so keeping the language going meant the brain cells were still working. We have fantastic medical and allied professional support, but speech pathology has been a game changer for us since being diagnosed with PPA. We are on a journey as the disease progresses, and having caring and professional help to navigate the communication and language challenges is very important to us. We are big advocates for speech pathology for people living with PPA. I am not sure that all speech pathologists are aware of the critical role they can play in supporting not only the person living with PPA, but also the people around them. Sometimes it's not about the important theory that is learnt at university or college, but providing very practical solutions to everyday challenges is so important. Each of us living with PPA has different needs, so having a patient-centered approach to the care you provide can make it very rewarding for all parties. That in a regional centre, it keeps us connected to current practices and standards and benchmarks so that we don't feel we're being left behind.
Okay, thanks so much to everyone who provided those lovely comments. Very, very opening our eyes to what people feel. So now I'm going to describe the many ways you can access a speech pathologist. And I know it can be a daunting task. And already on the question and answers, there's a question about how do I find a speech pathologist? So the reason it can be daunting to find a speech pathologist is partly because there's so many different pathways to accessing speech pathology. Just simply, for instance, there's the public system and the private system. And today's awareness project sort of has a sub-aim of having a positive effect on access to speech pathology services. It'd be great if they were prioritised in services to a greater extent. So next slide. Our first port of call is your medical team. Perhaps if a neurologist or a geriatrician has made a diagnosis of PPA or suggested PPA as a possible diagnosis, they will have already suggested a speech pathologist to you. But if not, sometimes your GP will know a speech pathologist in your local area who can provide service or who can direct you to a speech pathologist with expertise in PPA. Sometimes it's not a very straightforward from A to B. As you've heard a number of times today, universities and university teaching hospitals are also a good avenue to find a speech pathologist. Some have specialist PPA clinics. I'm here in a PPA clinic in a public hospital. Many have student clinics where a qualified speech pathologist supervises students. And these student units benefit greatly from working with PPA because the students may not otherwise ever have experience with this condition. As well, hospitals may know of research studies that are recruiting participants with PPA. So you might be directed to a research study that you could be involved in. The speech pathology department in a university teaching hospital may be able to point you to these options. I think you've heard today reference to many of the wonderful services that are available through Frontier, which is a University of Sydney research institute, and I know there are similar institutions in other states in Australia as well. Next slide. Now, the next access point is Speech Pathology Australia website. You go to a page called Find a Speech Pathologist. Okay, so Google Speech Pathology Australia, and then you'll find a page like this that says Find a Speech Pathologist. Type in some keywords such as adult, PPA, and perhaps the name of the suburb you live in, and the site will generate suggestions of private speech pathologists who meet your search terms. So next slide, when we talk about private versus public, we need to talk about funding options. So if you have private health insurance, you may have cover for some speech pathology. So it's a good idea for you to check yourself, as the speech pathologist won't be able to tell you, as all private health insurance plans are slightly different. If you don't have private health insurance, or even if you do, everyone can go to the GP and ask for a chronic disease management plan. These used to be called enhanced primary care plans. They're an Australian government initiative under Medicare. that allows general practitioners to refer patients with chronic medical conditions to allied health services. So then with this plan, you get a subsidised rebate on part of the cost of up to 5 allied health services per calendar year. Okay, next slide. If you're under 65, things are slightly different. You're likely to be eligible for NDIS funding. You need to check your eligibility to access speech pathology through NDIS. You need to be having a permanent and significant disability that impacts either your ability or both your ability or either your ability to communicate and or swallow. A diagnosis of PPA means that that criteria is absolutely met. Yeah, there's an age eligibility, and you must be under 65 years old when you apply. And of course, you must be an Australian citizen or hold a permanent visa and reside in Australia. Thanks, Kim, Jade. For people over 65, My Aged Care is the funding provider. People over 65 years of age living in the community can access funding for speech pathology via a home care package. And there's been a lot of talk about the changes that are coming in on the 1st of November, and one of them is a new program called Support at Home. Support at Home will provide funding packages for a variety of care and support services to keep people as independent as possible for as long as possible at home. And that's including allied health services and including speech pathology. You need to contact My Aged Care for more information on this and to arrange an assessment. And the number's there. Okay. So now I'll just give you an idea of some of the resources that are available. The first one is the Australian PPA Guide. This is a fantastic resource, and it's free to download from 2 websites. It's free to download from the Australian Aphasia Association website and from the Forward with Dementia website. If it's not possible for you to, you just Google either of those organisations, you'll be able to find the PPA website, the PPA Guide, I beg your pardon. Because we had a really lovely, generous donation from Mrs. Arlene Howes, whom I know is watching. Her and her late husband, Alan, donated funds to have a set of the guides published in hardcover, and we still have quite a few. So if you don't want to, if like Arlene, you don't want to read it online, you can have a hard copy. Just send me, Cathy Taylor-Rubin, a stamped self-addressed envelope, an A4 envelope, to that address, and I will send you a free copy of the hard version. Another great website is the Frontier website. I've heard a lot about Frontier today, and they have really fabulous information, very clearly presented on their website. Now, although this group is located in Sydney, it doesn't matter where you are in the country. You can access this information and know that it's based in good science and good evidence on Australian populations. Another great website is the Carer Gateway. It has lots of information, and I've only highlighted one thing here, the Carer Gateway Emergency Care Plan. Sometimes caregivers will say to me, but what if I get sick? What do I do if I need to call an ambulance and my partner needs me? Now, there's these lovely care plans that you can complete on the Carer Gateway and have ready for those sorts of situations. Hopefully they'll never come up. The next one is a wristband. So we've got various ways of providing information if the person with PPA is in some sort of mild crisis, or needs to have someone help them. Some ID is really helpful. This is a fairly new version of ID, very contemporary looking. Yeah, these little nylon wristbands are available online, and I think they cost about $45, $50. A little less high tech is the Hidden Disabilities lanyard. This is part of the Sunflower Project. You can get these from here, this website. I just recently had a patient who travelled to Melbourne on his own to have a catch up with old mates. And he wore the lanyard, and as a result, he said airport staff were extremely helpful and made his passage through the airport so much easier. I know some people wouldn't want to be so visible, but other people may. It's all an independent choice. So we've got another resource here on the Carer Gateway. This is a in case of emergency ID card, so a bit like the wristband, but a little card form that you might have in your wallet. You may never need these, but they're really good to have just in case of an emergency. There's also a very nice in case of emergency card that you can personalise. You fill in the information, you download it, and then you print it on the Australian Aphasia Association website as well. Now, this resource is on the Forward with Dementia site. Many people tell me they worry about disclosing their diagnosis. It's a very tricky time when you start to think about who you're going to tell and when. So this resource on Forward with Dementia is helpful. I think it helps people get their thoughts together and how they're going to go about disclosing when they're ready, when they want to. And then the next one is the Kisser phone. This is an adapted mobile phone. It's small and contemporary looking, and it's so much less complicated to operate because many of the apps and programs on a typical mobile phone have been removed. You can make calls and receive calls, but only from a limited number of people. You choose that yourself. You can see here this one that's shown in the picture has just eight contacts. So the only people who can call you are those 8 people. So it's a scam-proof phone. You won't be scammed. You can send and receive texts, but again, just from these people that you've nominated. It also has an emergency button at the back, a call for help type button, an identification plate, and an optional tracking service. If you're thinking about something like this phone or any other modified phone, you need to start with this early and use it every day to get used to it, because it's different from what you've been using over previous years. So it's always hard to learn a new device, even if it's a simplified device, but if you start early and practice every day, it will become an asset. And finally, the last one here is this lovely dementia awareness poster created by the speech pathology students at Frontier at the moment. And you can scan the QR code to access more of the information they have on that site. So this is not an exhaustive list of resources that are available, but it's just a set of some of the top resources that clinicians recommend to families and patients. So now, finally, these are our last quotes. So Penny, I'll hand over to you.
Okay, so we asked, how does speech pathology help people living with PPA? People living with PPA have lots of challenges, but we need to understand that speech pathologists can really help maintain our communication and make living with PPA better. The tools I have learnt to maintain my language skills can only be credited to the great speech pathology resources I have had the privilege to be exposed to over the last few years. We are big believers of the positive impact speech therapy can be for people living with PPA. This doesn't mean that the service has to be face-to-face. We have found that speech pathology delivered by telehealth or Zoom has really worked well for us. A number of people living with PPA may have mobility issues or don't have a driver's license anymore. There is less stress for the care partner and the patient as there isn't any travel time. The patient is more energized and focused in their own relaxed setting, so less energy has been used up traveling, so the session is more productive. It's helped me getting out and being able to converse with other people and in different situations, and has helped me keep a lot of friends who are quite willing to help me out when I'm having bits and pieces going wrong.
Well, I think the answer to that is, everyone's a little bit different. Everyone, we tailor our speech pathology activities and exercises to each individual, and it really depends on what you're working on. So sometimes if we're introducing new strategies, sometimes the effect of those strategies can be very rapid in that you instantly see an improvement in the success of communication. If you're working on actually rebuilding some word finding or speech fluency or sentence construction skills, that can take a little bit longer. Research studies typically enroll people in therapy for about a default 4 weeks. That's not saying that 4 weeks is what you need. It's just saying usually you get some results within 4 weeks. But it's very important to understand that, you may only see the speech pathologist once a week, but you'll only get those changes if the exercises are done, are practiced, or, also done when you're at home or out in the community. So it's like anything. If you're trying to learn or relearn or improve any type of skill, it's one of those that you have to sort of do a little bit every day. And the speech pathologist will help you best structure that practice so you can get the best effect. So it's a bit of a hard question to answer because it really depends on where the person is in their journey, how much support they have to do that practice, and how, those sorts of things.
And I suppose the answer, Penny, would you agree, is the same as the answer that Kirrie's just given. It sort of depends upon the individual and their strengths, their retained language strengths, to which strategies work best for them.
Yeah, absolutely. So there's lots of different possibilities. I think the general rule of thumb is to try and start lower tech or lower cost, rather than launching in at the top end of the range, particularly if you're going to be taking on some technology. Things are changing in the technology supports all the time, and there's some fantastic features for iPhone users. For example, live speech is a free setting on the phone where you can type messages and have them spoken by the phone. Also, while you're making phone calls, you can create your own personal voice in Apple for free, which is a form of voice banking. So I would recommend that people start with that kind of thing first, or writing and pictures, and see how you go.
We we've just finished it, so we haven't quite shared it yet. We have got a report which kind of captures the main findings, so we could absolutely share that with you, but we are in the process of writing it up and hope to see it published soon. But if there's anyone out there kind of keen to just learn a little bit more about the project, about how we went about the co-design process, the team would be so happy to share. So please feel free to get in touch via email and we can provide some of that support.
And to my knowledge, there's not a list available. It's a bit like trying to find a speech pathologist. When you find a speech pathologist who has a more substantial number of people on their caseload with PPA, that's when you will see that there'll be a group, a language group or a support group or a carers group sort of arises out of that, because this is a rare condition. And so some centres, particularly in regional areas, might have a very small number of people and it's not possible. But I know I run a language group here at my facility. I know Penny runs groups at Frontier. I can't talk to other states. Anyone want to add to that?
I think just to say, we know that there are key people in each state who are working in the PPA space. So I think it's finding that knowledge holder and kind of using them to then connect you to services that are available. So I think it's also something we hope that will start to come out of this awareness day, and having events like this, that we start to compile that knowledge so we can share it. So I think we know that that's a real need and something that we're committed to developing together over time.
It was called PPA 10 years ago and even 20 years ago, to my knowledge, but there was a lot of a lot of people were not diagnosed in the past. And maybe you could talk about, that when it was first identified by Messelam or something like that, and because it's relatively new, isn't it?
It's interesting, isn't it? Yes, it is reasonably new. The seminal papers by Mesulam were in the mid-80s or late 80s, so about 35 years ago. And it's one of the things where it started with a publication of a case series where Mesulam describes some people presenting with focal language disturbances and that were associated with more focal brain changes. And then for semantic dementia, so the semantic variant, there was some papers published by Elizabeth Warrington in England and John Hodges again in the late 80s, early 90s. Same thing, reporting first a series of in single cases presenting with a new syndromes or a new set of features that people hadn't reported before. And like any discoveries, once we've identified that, then suddenly other medical professionals, allied health professionals turned around and said, yes, of course, they're here. We can see them. So it was part of it was to be able to put the finger on this and being able to formalize these presentations a bit more clearly. But as I said, it's something that is still evolving. And for me, the one limitation remains the focus on language exclusively, whereas we know that people with PPA experience different difficulties and that go beyond language.
Right. So primary progressive apraxia of speech is, many of us consider it a distinct condition. So the thing is, in the non-fluent variant, the diagnostic criteria include having grammatical difficulties, so having difficulty constructing sentences grammatically, and or a motor speech disorder, which is apraxia of speech. So apraxia of speech is difficulty actually planning the movements. So you might have the words in your head, but your brain cannot generate the proper commands to make your articulators produce the sounds in the regular way. And so it's what we call a motor speech disorder. So technically it's not an aphasia, even though it is grouped inside non-fluent aphasia. So there has been a move to pull it out and consider it separately. But the thing is, just as in stroke, the non-fluent aphasia, the agrammatism, and the apraxia of speech often co-occur together because the parts of the brain that control those two skills are very close to each other. So any damage that hits one area often hits the other area as well. But they are two distinct conditions, quite different conditions that require different interventions. There has been this move to this concept of primary progressive aphasia, where primary progressive apraxia of speech, where apraxia of speech is the predominant condition and aphasia may or may not be present. And that has been associated in some cases with a different pathway forward and how that changes over time. So it has been considered important to differentiate that group because they might have a different pathway. So yes, it's a real thing. It's a different condition to aphasia, but it is quite difficult to diagnose.
Okay, I think we're getting the wrap-up signal. Thanks, Kirrie. That was a really good explanation. And I think it's really important to point out too that when Olivier said at the beginning, if you've met one people with PPA, you've met one person. It's the same with non-fluent variant PPA. There's really a need for us to distinguish the subgroups within the non-fluents as well. So it's a developing science and continuing. Hopefully our treatments and our care will continue to improve and grow. And hopefully this has brought about a greater awareness. Thank you all very much for joining.